Welcome to another COVID update. My name is Stacey Carmichael and I'm joined by the Minister of Health, the Honorable Dr. Frank Anthony. Minister, it's a pleasure again having you on the program.
Well, thank you very much for having me.
Now, let's get into it. Minister Anthony, briefly, an update on where we are presently statistically as it relates to COVID-19.
Well, what we've noticed is that we continue to have cases going up. So as a total of all the cases since March to now, we have 1,885 cases. Over the last 24 hours, with the testing that was done at the lab, we have recorded 32 new cases, and unfortunately, we have experienced another death. So right now, the death toll from COVID-19 in Guyana is about 58. So we continue to do our best, but it would be important for us to prevent these infections from happening because that is our best form of defense. While a lot of people who would get the infection would remain asymptomatic or without any symptoms at all, or some would have very mild symptoms, there would be a percentage of people, probably about 20% or so, that would require hospitalization. And of those 20%, maybe about 4% or so would be very critical and would require care in one of the ICUs. Those patients would experience COVID in a much more severe way. And our experience has been so far that a number of these patients are older patients. They have other what we call comorbidities or other diseases such as diabetes or hypertension or heart disease. And if somebody like that comes into the unit, they're at a higher risk. And so we have seen many of the patients who have passed away would have had a lot of these risk factors. So we want to urge persons who, and they would know themselves, persons who would have these chronic non-communicable diseases such as diabetes, hypertension, heart problems, and so forth, to take extra precautions so that they can avoid getting COVID. And those extra precaution means if you don't have to be out in the public, don't go out. Stay away from crowds. And if you have to be in crowds, well, then keep your distance at least 6 feet away from the other person. We want to also emphasize that persons must wear their mask all the time when they're in a public space, because mask wearing actually prevents people from getting this deadly virus. So we want to encourage that and to encourage people to sanitize their hands, for about 20 seconds at least, using soap and water. These simple measures can really help to prevent the disease, and therefore I want to urge persons who are at risk, those that I have mentioned, like the chronic non-communicable diseases, persons who are obese, persons who are older, to take additional precautions to make sure that they don't come into contact with someone who would have been exposed or would have been positive for COVID-19.
Thank you very much, Minister. Now, as it relates to the COVID-19 facility at Lilindal, how has the process of getting patients there, looking after them, and I know you had some challenges there as well. How is that process coming along?
Well, we did have some challenges in terms of the plumbing. We have been fixing that. I think by now we would have gotten over some of those challenges. And therefore, we now have about 20 patients who are in that unit. Those patients are basically from our maternity unit at the Georgetown Hospital. They are mild patients. They have been tested positive for COVID, and basically we're using the facility to isolate them. So each person who is there would have a separate room and amenities to go with that room, meaning a bath and toilet and so forth. So they basically have their own room, and they would remain isolated until such time that we can discharge them. I think it's much better for them to be there because we are preventing cross-infections in the hospital, so this is the most appropriate place for them. We also are looking, because as you know, in this current budget, we have about $700 million that have been allocated, and a lot of that money is going to go into upgrading other sections of the hospital so that we can house more patients at the hospital. One of the things that we want to do there is to ensure that we have the ICU unit up and running, and therefore some of the funding that we have received from this current budget, we'll be doing that. We'll be using it to develop a new ICU at the Ocean View Hospital.
Thank you very much. And Minister, some questions have arisen as it relates to the use of various drugs to treat COVID-19. Where are we in terms of that?
Well, one of the things that we have been able to do over the last week or so was to procure a medicine called remdesivir. It's an antiretroviral medicine, originally developed for the use in the Ebola epidemic that you had out in Africa. But then this medicine has been repurposed and has been used for COVID-19 patients. It's produced by a company called Gilead, and all of the production that they have in the United States have literally been bought up by the United States government, and they have been used on patients in the United States. Now, what the studies have shown with remdesivir is that it has been able to reduce patient stay in an ICU. So if someone will have stayed for maybe 14 days or so in the ICU, when you use remdesivir, that person probably can get home after the 11th day. Now, this was something that we have been seeking to get into Guyana, and we have been able to procure what is called a generic version out of India. And the Indians are manufacturing this on the license from Gilead. So we've been able to source this drug at a fraction of the cost, and this medicine is right now available to our very sick patients in the ICU. So I think this is going to help some of our patients. As I have said before, this is not the panacea. It's not going to fix all the problems that we have, but certainly it would help a subset of patients who would usually respond well to this medication. So I'm actually happy that we were able to source it, and we will be able to give our very sick patients so that they can recover much faster. There are other medications that have been used, and the doctors there have adequate supplies of those. Some of them are the regular meds that we will use, such as dexamethasone and so forth, and they have adequate supplies. So in terms of the care of patients with COVID who are in the ICU and so forth, we have all the meds that are currently on our treatment guidelines available to those doctors to use in the ICU.
Thank you very much. And where are we also as it relates to training? I know a lot of medical personnel are currently receiving training. How are we with that?
So one of the things that we wanted to do was to train doctors, especially those on the periphery, to learn more about how to use ventilators and different types of machine where we can ventilate a patient. So there are different types. You have something called a CPAP machine, you have something called a BPAP machine, you have ventilators, and different types of machine, they play different roles. And so what we have been doing is training our doctors to be able to utilize these apparatus and to know when to put a patient on this type of apparatus. And while they did it, or they're doing it right now in a theoretical way, and the training is online so that they can access it in the various regions, once they complete this training, we'll then invite them over to the GPHC so that they can take part in a practical training. So we're hoping that maybe by the end of this week, that some of them would be able to come down and do the practical training. Now, a lot of this is in preparation so that when we buy machines for the regional hospitals and we set up what we call the regional ICUs or ICUs at these regional hospitals, that we'll have trained personnel to man these systems in these regional hospitals. So it's really anticipatory. We are planning ahead, and we have already made provisions with some of the funding that we have received to buy new equipment so that we can place it at a regional hospital. So once budget is over, we are hopeful that we would be able to source these equipment and get it into Guyana quite quickly so that we can put these equipment at the regional hospitals. So it's a work in progress, but training is an essential component in the treatment of patients. And we want all our doctors to understand what is the latest related to COVID science and how to utilize that in the care of our patients.
Thank you, Minister. Now, as we wrap up the program, any closing remarks?
Well, as usual, I want to keep appealing to people that the only way that we can defeat this virus is that we all have a responsibility. So it's not about one person doing the right thing and all the others get a free pass. Everyone in Guyana would have to do the right thing. And it starts with wearing a mask, especially when you're in public, and doing it correctly. Because I've noticed that there are some people who wear their mask, hanging it off their ear, sometimes below their nose, on their necks, but the vital area that they're supposed to cover, which is the nose and mouth, is not being covered. So we want people to wear their masks correctly because that is important and that is what is going to prevent transmission. We also want people to maintain social distancing when they're in the public and, of course, to sanitize your hands appropriately when you touch surfaces such as doorknobs and so forth. So I think once we start abiding by these rules, make them a part of our daily routine, we would be able to curtail the virus, and I think that is important. So if we all work together, we will be able to curtail this virus, and all of us would be much safer. So I hope that each one of us can do our little part to make sure that the numbers that we are getting go down, and we can all do this if we work together.
Thank you very much, Minister. And thank you once again for being on the program.
Thank you.
Thank you to the listening and viewing public. This has been COVID Update.